The cost of food means South Africans are forced to buy cheaper, less healthy food. Alongside high levels of starvation, South Africa is now the most obese nation in sub-Saharan Africa.
Now that I'm just weighing 120, they told me that I must lose at least that 20 because I was weighing 150. So I lost so much weight for the past 6 months. So since then, I have to lose another 20, at least maybe be 100.
Like Nkosi, a 24-year-old mother of 3 living in Alexandra Township, is 8 months pregnant. She's also unemployed and clinically obese, weighing 120 kilograms. Doctors have warned that her health is dangerously at risk, but she is unable to afford healthier food alternatives.
Oh, he told me that I'm going to have a heart disease and it's going to be a little bit difficult for me in during labor. So I might actually lose my life. So since then, I became free, so I even told my mother about that. So I never became stressful about it.
When you live in a community where it's poverty-stricken, the priority will be to fill your stomach up. As long as it's not poisonous, then that's okay. So healthy eating, I think it's in the list of people's worries about, people worry about where do they get food and get food immediately, not what type of food it is.
I think the term food apartheid is very, very apt for a couple of reasons. The first thing is that it has long been normal in South Africa for poor black people to go hungry. This is not something that's been invented in the last 20 years. Poor black people have gone hungry in this country for the last 100 years.
Hunger and obesity are both symptoms of the cost and accessibility of food in South Africa. Dr. Tim de Meyer has seen the increasing rise of diseases like diabetes and cancer among new mothers and their children. The long-term impact of these health issues, he says, are severe and far-reaching.
There's a lot of research recently that has shown that malnutrition in the first 2 years of life has got an impact on later diseases in adulthood. The presence of obesity, the presence of hypertension, the presence of diabetes, and even things such as cognitive capacity and capacity to be a productive member of society.
This cycle may continue for Lucky's unborn baby, who will be predisposed to developing early onset diabetes, high blood pressure, and even childhood obesity.
I don't want to lose my babies. I don't want them to lose their mother, since they're all I have. So I don't want them to lose me, actually. So I can see their future in the next present.
The first 1,000 days from conception to 2 years is, the window of opportunity, and the only period in which we can address both the physical and mental development of a child. We miss that gap, and no matter what we do beyond that, that child is permanently damaged.
In South Africa, 9 and 10-year-olds are among the highest consumers of sugary drinks in the world, beaten only by children in the USA, according to research.
That's the first thing I tell parents when they have a problem with a child who's overweight, is to cut out sugary drinks, because you don't realize how many calories you're taking in. But equally, there's a large amount of sugar in what we consider to be healthy drinks, like fruit juice. And parents are not aware of this. And cutting those out and replacing it with water does a huge amount for limiting our excessive sugar intake. And I'm a big proponent of sugar tax.
I always do cough rings, so wow. They told me to limit too much acid. So since then, I only do juice, or homemade juice. We live to share, people. Let's share.
Dietitians have advised Lucky to urgently eat healthier foods, but she cannot afford to do so.
They're too expensive, so I cannot afford. So he told me that I must at least eat twice fruits. So since I'm expecting, I told him, what am I supposed to do? So what am I supposed to do? So since then, I left it with a question mark, so I don't know.